Hi, Dr. Jeffrey Lehrman. Happy Friday. WebCME wants you to start your weekend with a win. The Clinical Connection Friday feature today is ankle sprains. One of the common things I see as a podiatrist is an ankle sprain, and sometimes injuries that were thought to be ankle sprains that turn out to be more than just an ankle sprain. The thing to know as an introduction to this is that there are ligaments on the outside of your ankle that connect the leg to the foot, and that's what forms the ankle. A strong, intact ligament can be pictured as being tight and strong together like this. And what happens with an ankle sprain is that ligament gets stressed, and the definition of a sprain is when that ligament gets stretched out and pulled apart. And that would be an ankle sprain. And there are different grades of ankle sprains. There are different severity of ankle sprains. But the differentiation is when the ligament actually becomes torn. So a sprain is when that nice strong ligament gets stretched out versus when it gets completely torn in half. And that would be an ankle ligament rupture. And one of the things we see all too often is somebody that has sustained a ligament rupture that has been treated as just a sprain, and it's 4 weeks later or 6 weeks later, and they're still not better because they didn't get adequate treatment. Most sprains can be treated with a short course of immobilization and then moving somebody to physical therapy and a brace, ice, compression, and elevation, and they do well. However, if that ligament is ruptured and it's torn in half and it receives that same type of treatment, it normally will not get better, or it won't get better in the amount of time that we want it to. If the ligament is found to be completely ruptured and torn in half, that normally requires immobilization, meaning cast immobilization or placing the patient in a cast boot, and sometimes there's even a period of non-weight bearing that is required. There are some clinical maneuvers that can be done to help to differentiate between an ankle ligament sprain and an ankle ligament rupture, and it also can be visualized with an MRI. X-ray allows us to visualize and see bone only, whereas an MRI can allow us to visualize soft tissue structures such as the ligaments that we're talking about that can get damaged with an ankle sprain or an ankle rupture. That's this week's win. We hope this clinical connection will enhance your practice. Be sure to send us your questions and follow us on Facebook, LinkedIn, or Twitter. Enjoy a safe and relaxing weekend.